BNC Chief Medical Editor Dr. Corey Hébert is here now to break it all down for us and to keep it real like you always do. Thanks for joining us today. So, Doctor, I want to talk about what we can expect in the next few months. A lot of people are still trying to plan to get back to normal or go on vacation, spring break. What can we expect? Do you expect these COVID cases to plateau or just start declining?
And I would hate to say that we are going to have a plateau in the next couple of weeks because as soon as we say that,
Mm-hmm.
people start wilding out. And I don't like to say that, but the reality is that from the data that we have in South Africa and data around the world, we would have a plateau around the end of February and the case would start to go down. I mean, there are five stages to a pandemic. And the first stage is true pandemic. The second phase is deceleration. We thought we had deceleration and then it started to accelerate again. So we're still in phase one of a phase of five phases of a pandemic. So we're not out of the woods by any means. But what I will say is that if we get the boosters the way that we need to get them, and we try to wash up, mask up, separate, vaccinate as much as we can, then we should probably see a little bit of a slacking off of the Omicron variant and the Delta variant by the middle to the end of February.
Well,
But just remember
mhm.
oh, go ahead. I'm sorry.
No, I was going to say that is until the next variant pops up and then we're back at
I
square
was
one again.
exactly, and the Omicron variant. There's BA1, BA2, and BA3. Those are the subvariants of the Omicron variant, and BA2 is causing havoc in Denmark. And so much so that some people feel that BA2 of the Omicron variant should be its own Greek letter because it's causing that much damage. Is it going to cause a lot of damage here? We don't know. But that is an option right now that we have to consider.
And then you got Deltacron on top of all that. And then the one
There
with
you
the
go.
flu, and I can't keep track of all of them. But
Flurona.
what I can keep track of is some of the mess coming out of the hospitals. You talk about wilding out. Some hospital workers are
Yeah.
actually being told to return to work with COVID, even if they possibly still are infectious. So is this a good way to end the critical staffing shortages that they're going through, or just a really dumb idea?
It's pretty dumb. I mean, once you are positive for COVID, really after 10 to 14 days, then you really are not infected. But the issue is that people are forcing their employees to come back to work right at that 5 day mark, which is still sketchy on or do you have the ability to transmit? I'm an ER doctor, so I mean, whenever we go in the hospital now, you have to be swabbed. As soon as you get swabbed, whether you feel bad or not, if you're positive, you can't work, and we have to call in the next person that's on call. And so that's causing a major shortage. I mean, I've never been called and been on fourth call and been called into the hospital, but I have been recently when you've had three other doctors that aren't sick but have positive COVID-19 tests. So, this is something that we do have a shortage. We do have to do something drastic, but putting sick people back in the hospital
Hmm.
that are the healthcare workers, that's not a good idea.
Not at all. Okay, now unfortunately, we got to ask this question because we got to clear up some of the rumors that are out there, some of the reports we've been hearing. How does COVID impact and affect fertility, and is there such a thing as COVID penis?
Okay, so finally something that can make black men go to the
Please.
doctor to get their booster shots, right? It does exist, folks, and I have to tell you that this is something that you don't want to wish on your worst enemy. Some people say 30, 40%. So basically what happens is your penis, if you get COVID will affect the nerve or COVID will affect the blood vessels. And that's the way it's done to the nose and to the tongue, because we know that if you have COVID, you have inflammation that can destroy the blood vessel. So you can't get blood to the end organ, which is the penis, or it destroys the nerve, the dorsal nerve of the penis, which actually does innervate the penis to make it erect. So the point is, no pun intended, you have to make sure that you don't get COVID because if you get this, you could get long COVID, and long
So
COVID could
wait,
mean erectile dysfunction.
so does that mean Nicki Minaj's cousin was sort of right? Friend's cousin's uncle's brother, whoever it was? Was it that? Wasn't?
The
Didn't
the
she say something
the
like
New
COVID affected?
the New England Journal of Nicki Minaj is wrong because they were talking about testicles, and so
Mm.
that it had nothing to do with fertility at this point. But if we really have to think about long COVID versus erectile dysfunction, I don't want to have to make that joke. finally,
Mhm.
finally, the fact that we can get rid of this thing. If we get rid of this thing, then we'll be good. But the
Mhm.
reality is, seriously, folks, if you get COVID, you can have erectile dysfunction permanently,
Mm. People are
permanently,
lining
and
up
that's just
at the
it's not working.
vaccines to get vaccines right now. You're like loss of taste and
Exactly.
smell are the least of your worries. But
At
before you
least, at least.
before you go, I have to get this out there because I've heard of a new rumor that the vaccines could actually kill off the vital white blood cells that you need to fight off other diseases in the future. Is there any basis to that?
No, no. At this point, I mean, vaccines don't kill off white blood cells. That's
Mm.
that. These are the types of rumors that we just have to dispel immediately and
Mhm.
look at disinformation in a way that look that's not the case. What the vaccines don't do anything to white blood cells. We make the antibodies are made from the vaccine. Antibodies are made, and that's what that's about.
All right, I'm glad Dr. Corey Airbear is always here to clear things up and to keep it real for us. Look, all the guys need
Absolutely.
to go head out and get that vaccine now. For no other reason, he just cleared it up. So,
there
all
you
right,
go.
thank you so much, Doc.